You know that feeling when you're trapped in an endless maze of treatments that just don't work? If you've been battling stubborn, persistent psoriasis plaques, you absolutely know the drill. It can feel incredibly isolating, right? Well, today, we're jumping straight into this explainer to chart a course out of that frustration. We're talking about finding real clarity using modern targeted science. We're going to unpack the actual science behind advanced biologic treatments, look closely at the clinical data, and see how patients are safely managing their long-term care.
Section 1. Beyond creams and light, when standard options aren't enough. This is honestly the most critical question for patients who are just feeling totally overwhelmed. What exactly is the next step when standard treatments just fail to clear your skin? Because, look, for many, psoriasis isn't just a few isolated dry patches. No way. It is a chronic autoimmune condition that can cover vast, highly visible areas of your body. It causes immense physical discomfort, and man, it takes a profound toll on mental health and daily life. It affects how you dress, how you sleep, how you feel about yourself. So when topical steroids or UV phototherapy hit their limit, the medical community turns to systemic therapies. And systemic basically just means treatments that work throughout your entire body. They target the immune response from the inside out rather than just treating the surface of the skin.
Now, this brilliantly illustrates the official NHS clinical pathway. It shows us the precise medical guidelines doctors use to escalate care to advanced biological agents. It's not some random guessing game, right? It's a highly structured, step-by-step ladder. Doctors evaluate patients based on very specific clinical milestones to figure out if it's medically appropriate to move beyond foundational systemic drugs, things like methotrexate or cyclosporin, and step up to that next tier of advanced therapeutics.
To actually qualify for these treatments, you typically have to try and fail those foundational systemic drugs first. Plus, you need a high severity score, showing a severe impact on your daily life. Medical professionals use what's called the PASI score. That's the Psoriasis Area Severity Index, which generally needs to be 10 or higher, along with a body surface area coverage of over 10%. Now, to picture what that actually looks like, in dermatology, 1% of your body's surface area is roughly the size of your palm. So 10%? That means these painful plaques are covering an area equal to 10 of your handprints. They also heavily factor in your quality of life. If your psoriasis is on high-impact sites like your face, scalp, or hands, that dramatically changes the equation. It can actually fast-track your eligibility because doctors recognize just how deeply those areas affect your everyday interactions.
Moving on to Section 2. Targeting the immune system, how biologics block inflammation.
It's pretty amazing when you think about it. Older systemic therapies, like cyclosporine, they're kind of like casting a massive net into the ocean. Sure, they catch the inflammation, but they also heavily suppress your whole immune system, pulling in and tamping down a lot of other essential immune functions right along with it. Biologics, though, are an entirely different ballgame. These are highly targeted, protein-based medications. They are literally engineered to fight the underlying causes at a microscopic, cellular level. They act like precision instruments, intercepting specific inflammatory signals without shutting down your entire immune system.
Think of cytokines as the chemical pathways causing your skin to overproduce cells. Imagine a busy highway where the traffic lights are just stuck on green. The cells just keep coming and piling up. Biologics act as the highly specific roadblocks that stop those signals dead in their tracks. In a normal, healthy immune system, cytokines like interleukin-17 and interleukin-23 are actually there to help fight off infections. But in psoriasis, they get stuck in that on position. They're constantly signaling the skin to produce new cells at an incredibly rapid pace, which is exactly what leads to those thick, scaly plaques. By dropping a roadblock in front of just these specific cytokines, modern medicine can completely halt the psoriasis overdrive while leaving the rest of your immune traffic flowing normally. That level of precision is honestly, truly a marvel.
All right, Section 3, IL-17 versus IL-23, comparing the newest drug classes.
Let's look at the clinical data and see how the two most prominent classes of these medications compare head-to-head. On one side, we have our IL-17 inhibitors, which studies show provide a faster onset and superior nail clearance. On the other side, we have IL-23 inhibitors, which offer incredible long-term sustained skin clearance. To really understand why they differ, we need to look at how they work in the body. The IL-17 drugs act slightly further downstream in the inflammatory chain reaction. Since they block the process right before the skin cells react, they are incredibly fast-acting. But the IL-23 inhibitors, they address the issue slightly further upstream, right at the source, by blocking a cytokine that actually regulates the production of IL-17 in the first place. And it's that upstream block that leads to those remarkable long-term stability numbers.